Hello everyone, I'm Dr. Mohan Kumar V, consultant physician and ECP consultant, Revive Hospital. Here again, I'm coming out with another interesting episode of ECP. So here we have Mr. Shashi Kumar, who is aged around 60 years. This particular case is very interesting and challenging for me because the previous experiences he had. So initially, if I took the history, is basically an engineer with MTech in software, lot of technology knowledge. He's working for a lot of multinational companies. Before he was into the defense, after that VRS he took and entered into all those multinational companies. Sort of high profile patient, I would say. So his history was very interesting and challenging for me. So initially, for heart attack or higher risk of angina, he went to a hospital in the year 2011. That was the first time he went to the hospital for a angina. There he underwent angiography and angioplasty. That time you were placed two stunts in situ at the that was at 2011. Again after 3 years, that is in 2014, again he developed angina and he underwent second angioplasty. That time also some ballooning was done, some another stunt was in place. It was also placed. Again after almost I would say 9 to 10 years, he developed third episode of angina and again he went to another hospital. Again another angiogram was done. This time they were not able to place any stunts because it was very narrow and they could only do the balloon angiography. So this was the history. With this history, patient came to me. Patient was advised at the last angioplasty, that was in 2023. So we cannot do anything in all the cardiology. They said we cannot do anything for you. The only last resort is bypass surgery. So Mr. Shashi Kumar was little skeptical about bypass surgery and he was looking for any other alternative treatment or alternative solutions which are available. That's how he came to us. So when he came to us, his history was this was the history which I got. Not only that, he was like I would say class very symptomatic or minimal exertion also used to get angina episodes. He was not able to carry out his day-to-day works in a qualitative way. That means brisk walk or climbing stairs or going up, stay in the building. Nothing was possible. He was having severe typical and atypical angina symptoms. That means chest discomfort, chest heaviness, chest tightness, all these symptoms Mr. Shashi Kumar had. With that history, he also gave one more important history, that is lack of memory or short-term memory gaps he used to experience. He was not able to concentrate on his work, lack of energy. These were the typical symptoms he presented to me. Then I explained about what is our ECP therapy, how it is going to improve the circulation. I told him two things. Number one is you should have confidence in the therapy. I'll explain you how does it work, number one. Number two, choosing the right set of medication is also very important. So he had multiple episodes of angioplasty, multiple revascularization, and few complications of angioplasty I would like to tell, because every time when you put a guide wire, when you disturb the plaque, it is going to be dislodged and deposited elsewhere in the brain. That's how he developed memory issues, because of memory area in the brain was affected with whatever the plaque dislodged, which got dislodged and lodged at that particular cerebral artery. So these are the complications. Apart from angioplasty complications, patients can also develop acute kidney injury because of the dye they inject. Some patients develop stroke also. I would say these are the minor and major complications of angioplasty. Unfortunately, Mr. Shashi Kumar had undergone 3 times angioplasty over a period of last 10 to 12 years. This was the history. So with that history, he came to us. We did ECP therapy for him, almost 35 sessions. Apart from modification in the medication, whatever previous medication he was taking, I stopped everything and started blood thinners along with low molecular weight, low anticoagulant therapy. With that, newer anticoagulant therapy. With that, after 35 sessions of ECP therapy, I feel Mr. Shashi Kumar has dramatically improved in terms of his angina symptoms, overall energy levels, overall ability to work, walk, all those things dramatically improved. So now I would like to ask Mr. Shashi Kumar, what is his experience? How does he feel about ECP therapy? So you have to come out with the whatever experiences you had, sir.
Yeah, it's a nice experience, and all the pain I have gone through in last about 13, 14 years, you have articulated very well. And I was thinking, the quality of life was very bad, and I was thinking, I am done. That is why I should take work retirement and read something and stay cool at home or something like that. So quality of life was very much affected. I should say it was no life at all. I should say that was the condition almost one month back. And after these 35 episodes, of the treatment, I should say, I was not able to climb even one floor earlier, and I used to feel heaviness in the chest pain and all those. The last 1.5 years after the last episode of what you call angina and angioplasty, it was done in 2023 September time frame. I was just not, not able to walk fast. Also, hardly I was walking, very slow walking. I was because I don't want to leave walking, because that's the only thing, little exercise I was getting. I was not able to do any other thing. And always just used to get little, very heavy even after little exertion also. And I used to become breathless. So today, after 35 episodes, I was able to climb the 4 floors without any effort. And maybe I would have climbed more. There was only 4 floors in this hospital. So yeah, I should try more floors and see that if anything, still I can tolerate more. So, that was the last 1.5 years, I have not climbed more than 1 floor, I should say. After 1 floor, I used to take, after half floor, I used to take rest, and then I used to climb remaining half floor. So that was the condition. So today I was able to climb, I think, how many steps in 4 floors? There are about 80 floors, 80 steps.
Yeah. So more than hundreds.
Yeah, around 80, 100 steps I was able to climb non-stop. And I didn't feel any difficulty. Only legs were paining because, legs are not trained for last 1.5 years. So otherwise, I was very comfortable, and I feel this is a wonderful treatment. People should opt for, and it is quite cost-effective also, and non-invasive. So that way, I feel it's a very good thing, wonderful medication, very wonderful treatment, I should say. Thank you.
Thank you, sir. Whatever Mr. Shashi Kumar said, we can see the dramatic improvement in the patient symptoms. Unfortunately, if you look at ECP therapy, not many, majority of the persons or even some of the doctors are not aware about ECP therapy. It is USFDA approved, very safe, and it is non-invasive. And till now, we have done for around 1,000 patients. All of the patients are doing extremely well. Some of the persons who are advised bypass surgery almost 5 years back, even today they come and say, share their gratitude with me. So I feel very, very happy about that. Unfortunately, this form of treatment, whatever ECP therapy we are talking about, not known to majority of the patients. Every day I come across in the hospitals who are suffering. Those patients who cannot be operated, non-stuntable, those patients still, they're not given the option of ECP therapy, which is one of the wonderful treatment, USFDA wonderful treatment options available, unfortunately underutilized. Apart from one more very interesting thing about Mr. Shashi Kumar, I wanted to tell you is, Mr. Shashi Kumar, almost in the first angioplasty that was in 2011, prior to that I was taking his history, he was not a smoker, regular exercise. Every day he used to climb around 7 flights of stairs at his apartment in Bangalore. So that means he was physically very active, non-vegetarian, never eat non-veg, not a smoker, not a alcohol, but only risk factor he had is a family history of or genetic history of heart attacks in the family. So what we have to understand is that we have to look at the risk factors for heart attack or coronary artery disease. So apart from modifiable risk factor, there is something called non-modifiable risk factor, which is genetic risk factors. So when the patients are at a higher risk of heart attack because of the genetics they inherit, what is the best solution? Proper screening, meeting the right consultant, undergoing preventive therapy, and choosing the right set of medication. If you don't do that, you're going to end up with a lot of complications, which probably Mr. Shashi Kumar could have been averted if you had come to me earlier. So with that, I'm going to end the discussion for today. Another important discussion about ECP. Again, I'll come back to you in the next episode. Thank you.